Welcome guys to this YouTube channel. Remember to subscribe and hit on your notification bell so that you can receive when we upload. Today we are discussing the COVID-19 vaccine myth and facts. We want to see what are the myths about COVID-19 vaccine, and we also give you the facts. Myth number 1. People say COVID-19 vaccine can affect women's fertility. The fact is, the COVID-19 vaccine will not affect fertility. The truth is that the COVID-19 vaccine encourages the body to create copies of spike protein found on the coronavirus surface. This teaches the body's immune system to fight the virus that has that specific spike protein on it. Confusion arose when a false report surfaced on social media saying that the spike protein on this coronavirus was the same as another spike protein called cysteine-1 that is involved in the growth and the attachment of the placenta during pregnancy. The false report said that getting the COVID-19 vaccine would cause a woman's body to fight this different spike protein and affect her fertility. The two spike proteins are completely different and distinct, and getting the COVID-19 vaccine will not affect the fertility of a woman as seeking to become pregnant, including through in vitro fertilization method. Myth number 2. Someone says, I have already got COVID-19, I don't need a vaccine. The fact is, people who have gotten sick with COVID-19 may still benefit from getting vaccinated due to the severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible. People may be advised to get the COVID-19 vaccine even if they have been sick with COVID-19 before. There is not enough information currently available to say if or for how long people are protected from getting COVID-19 after they have had it or a natural immunity. Early evidence suggests that natural immunity from COVID-19 may not last very long, but more studies are needed to better understand this. Several subjects in the trial who were previously infected got vaccinated without ill effects. Some scientists believe the vaccine offers better protection for the coronavirus than natural infection. Another myth. People say researchers rushed the development of the COVID-19 vaccine. So is it effective and safe? The fact is, studies found that the two initial vaccines are both about 95% effective and reported no serious or life-threatening side effects. There are many reasons why the COVID-19 vaccine could be developed so quickly. Here are just a few. 1. The COVID-19 vaccine from BioNTech and Moderna were created with a method that has been in the development for years, so the companies could start the vaccine development process early in the pandemic. China isolated the shared genetic information about COVID-19 promptly, so scientists could start working on the vaccine. The vaccine developers didn't skip any testing step, but conducted some of the steps on the overlapping schedules to gather data faster. Vaccine projects had plenty of resources as governments invested in the research or paid for the vaccine in the advance. Some types of COVID-19 vaccines were created using messenger's RNA, which allows faster approach than the traditional way that vaccines are made. Social media helped companies to find and engage study volunteers, and many were willing to help COVID-19 vaccine research. Because COVID-19 is so contagious and widespread, it did not take long to see if the vaccine worked for the study volunteers who were vaccinated. Companies making vaccine early in the process, even before FDA authorization. So some suppliers were ready when authorization occurred. Another myth. Someone says getting the COVID-19 vaccine means I can stop wearing my mask and taking coronavirus precautions. Facts. On May 13, 2021, the CDC revised safety guidelines for those who are fully vaccinated against the coronavirus. The updated guidelines stated that fully vaccinated people can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules and regulations, including local businesses and workshop guidelines. The CDC continues to recommend that masks and physical distancing are required when going to doctor's office, hospitals, or long-term care facilities. Someone says getting the COVID-19 vaccine gives you COVID-19. The fact is COVID-19 vaccine cannot and will not give you COVID-19. The two authorized vaccines instruct your cells to reproduce a protein that is part of the SARS-2 coronavirus, which helps your body recognize and fight the virus. If it comes along, the COVID-19 vaccine does not contain it. Someone again says the side effects of the COVID-19 vaccine are dangerous. The facts are, in April 2021, the CDC temporarily paused and then resumed the use of Johnson & Johnson vaccine. The Moderna vaccine cannot have side effects, but the vast majority are very short-term, not serious and dangerous. The vaccine developers report that some people experience pain where they are injected, body itches, headache or fever lasting for a day or two. These are signs that the vaccine is working to stimulate your immune system. If symptoms persist beyond 2 days, call your doctor or visit the doctor. If all allergies, especially severe ones that require you to carry, discuss with the doctor before you can get the vaccine. Another means is the COVID-19 vaccine enters your cell and changes your DNA. The fact is COVID-19 vaccines are designed to help your body immune system fight the coronavirus. The messenger RNA from two of the first types of COVID-19 vaccine does not enter cells, but not the nucleus of the cells where DNA resides. The mRNA does its job to cause the cells to make protein to stimulate the immune system, and then it quickly breaks up without affecting your DNA. Someone says the messenger RNA technology used to make the COVID-19 vaccine is brand new. Facts: the messenger RNA technology behind the new coronavirus vaccine has been in development for almost 2 decades. Vaccine makers created the technology to help them respond quickly to new pandemic illnesses such as COVID-19. Someone says the COVID-19 vaccine was developed with or contains controversial substances. The first two COVID-19 vaccines to be authorized by the FDA contain messenger RNA and other normal vaccines ingredients such as fats, which protect the messenger RNA, salts, as well as small amounts of sugar. These COVID-19 vaccines were not developed using fetal tissues, and they do not contain any materials such as implants, microchips, or tracking devices. Again, someone says, now that we have a vaccine for COVID-19, we can make vaccine for the common cold, HIV, and other diseases. Facts is, the thousands of viruses that cause various diseases are very difficult. Many change year by year, making it difficult to develop one vaccine that works for a long period of time. Developing a vaccine for some diseases causing viruses is tough. For example, the virus that causes HIV can hide and make itself undetectable by the human immune system, which makes creating a vaccine for it extremely difficult. The common cold can be caused by any other of hundreds of different viruses, so vaccine for just one of them would not be very effective. Please do subscribe to Health Center Point. Thanks for watching. See you next tomorrow.